Infertility, which is on the rise for the last couple of years, is increasing alarmingly in the last 5 to 10 years, and the basic reasons which have come to the surface is the stressful life and adulterated food and leading a very stressful life. Besides that, the other reasons why infertility is on the rise is low sperm count found in most of the patients, in the males, and polycystic ovaries and blocked tubes. This has been seen in many people. But the modern day life and a stressful living is a major cause now, which leads to hormonal imbalance and low sperm count, which leads to no egg formation or poor egg qualities. In today's episode, I am going to discuss with my viewers on ICSI, intracytoplasmic sperm injection. It is an international technique and it is a wonderful technique which has come to the aid of those couples where the sperm count is very low or where the sperm count is nil. These couples, earlier when the sperm count used to be nil, they had to then rely on donor sperm program. But now with the coming in of this fantastic technique called ICSI, intracytoplasmic sperm injection, those couples where the sperm count is nil, we put a needle in their testes. It's called TISA, testicular sperm aspiration, and if we find sperms over there in the testes, then we can use those sperms for getting a baby for this couple who earlier used to go for donor sperm program. We proudly announced that we gave the first ICSI baby of Punjab in 2000, around about 14 years back. And ICSI is a technique which is utilized there where the sperm count is low or nil, where the egg quality is low or fertilization rate is very poor, or those couples where they had previous failed IVF cycles, they also can go for ICSI. Virk Hospital Jalandhar, I proudly announce that, is the only ICSI clinic in India which is NABH accredited. We got this accreditation 3-4 years back, and to get this accreditation, my international patients can understand that getting an NABH accreditation is very tough. Out of the 300 to 400 clinics in India who are practicing ICSI, Virk Hospital is the only clinic to be NABH accredited. In ICSI, what we do is that, one thing more I want to add here is that Virk Hospital is the only center where we are working with 9 to 10 CO2 incubators, and this is the only center which is having 2 ICSI machine. It is a very expensive equipment. Having one ICSI machine is very tough, but we are having 2 ICSI machines because the patient flow, particularly from US, Canada and Europe and Australia and the Gulf country, is so high that we had to go for the second ICSI machine. This is the only clinic where we make sure that there are no infection or any VOC materials in the ICSI lab and the ICSI theatre, for which we are using those air purifiers which are recommended by NASA, like aerosites, as well as we are using Coda towers to clean the air so that the quality of the lab is as per international standards. Virk Hospital Jalandhar is working day and night. Our staff, our doctors, they're working day and night for the last 20 years to improve the quality of the treatment as well as to improve the percentage of the success rate, for which we keep on updating ourselves by attending various international conferences in US, in Europe from time to time, as well as we keep on doing research on the latest updates on infertility management. In ICSI, what we are doing is that we make lot of eggs in the ladies by giving her fertility drugs on day 2 of the periods by a IVF and ICSI expert. Then they are taken up till day 12 or 13, and when we find that the egg quality is very good, then we take out the eggs in a ICSI theatre one by one under ultrasound guidance by a procedure called egg pickup or ovum pickup. These eggs which are taken out one by one are then handed over to a ICSI research lab to an embryologist, who then identify and scans the eggs under the microscope to make sure that what is the quality of the egg. And once the eggs are taken out and they are then converted and they are then designated into good eggs or bad eggs, then out of these eggs the best quality eggs are taken for ICSI procedure. These eggs are incubated in the CO2 incubators, and we proudly announce that we are having 9 to 10 CO2 incubators in the lab, the only clinic in India having so many incubators. And once the incubation is done, then we take the sperms of the husband. If we can get the sperms from the semen ejaculate, they are taken out from the semen ejaculate. But if we don't find any sperm